Welcome to the Concerned Parents of Young Athletes podcast, where we dismantle the confusion and provide the facts on structural management, a system designed to prevent injuries, understand the unique structures of every young athlete, and provide effective treatments, all based on structure, science, and common sense. This is episode 9, X-rays and MRIs. I'm Dr. Tim Maggs. Let's get started. I realized years ago that without an X-ray, you cannot know what that structure looks like. And as the technology has advanced and now we have digital X-rays, I have amassed the largest database of biomechanical X-rays of anyone in the world because I've been in practice 47 years. I started practice knowing the importance of the X-ray, and I have X-rayed every patient I've had. I have the largest database of biomechanical X-rays of middle school, high school athletes of anyone in the world because 21 years ago when I started the Concerned Parents of Young Athletes program, part of that examination included 4 standing X-rays. Now, the thing that parents are concerned with, obviously, is it's safe. And the answer is absolutely yes, because every day in this country, hundreds, if not thousands, of CAT scans are being done routinely, and CAT scans can range anywhere from 40 to 50 low back X-rays amount of radiation. So with digital X-ray, the amount of radiation is minimal, but the amount of information you get from them is maximal, and it will change a child's future. So just to establish that point right in the beginning. Now let's show some of the reasons why X-ray is so critical at this age. First of all, as I said, I have the largest database of anyone in the world of this age group. So I have looked at more biomechanical X-rays than anyone. So I don't think that there's anyone out there who has the same experience at understanding the information on that X-ray as I do. So let me show you a couple pieces of information. If you look in the upper left-hand corner, 13 years old, male, he has a 6.3 millimeter difference in the height of his hips. Now, 3 millimeters and below is normal. Above 3 millimeters starts to alter the weight distribution going through those lower extremities. Why is that important? If you watch pro sports and you see these Achilles tears, you see these meniscus tears, you see these hamstring pulls, low back injuries, the root of many of those are the imbalance in the hips, the weight distribution imbalance, because in our sports medicine industry in this country, this is never looked at. Now let's take a look 2 years later when we took his same X-ray at 15 years old. He now is at 7.7 millimeters because legs do not grow evenly. And not only do we not look at this at all, we aren't looking at this as this young man grows, which is mandatory so that we can compensate with the appropriate lift and orthotics to level those hips as much as possible. Let's take it a step further. Here we are with this young boy at the age of 17 years old. And if you look, 10.6 millimeters. Legs do not grow evenly. This X-ray has to become part of every young athlete's biannual study so we can compensate appropriately with the appropriate orthotics and lift to fix their feet and level their hips. That's what has to happen. So here is a very common finding that left knee is tucked in, called an increased Q angle, left foot more collapsed than the right foot. And again, on that pre-participation exam, this is not looked at. Now, when you look at this, you have to assume, look at the shorts, that his hips are not level. So putting him through our exam, putting him through the corrective care, this is the outcome. And again, this is the goal for every young athlete before they take the field or the court, to balance the structure as much as humanly possible, to balance the weight distribution. So now let me quickly just show you normal and abnormal. Here's a side view of the neck, and that side view of the neck shows a curve. That curve is very important because that provides tremendous shock absorption. And you can see the pencil mark going through the entire neck. That's the center of gravity of the head, which is 10% of the body weight. So it's very important to know what that neck curve looks like and the center of gravity looks like because if it's not correct, then there are things that can and should be done on a proactive basis to keep the weight distribution through that neck correct. So let's look at very common abnormal finding, and you can see that the center of gravity is severely forward with a reverse curve. What this does is it changes the engineering loading going through the neck. And so when you don't look at this and you don't do any of the positive proactive things to mitigate the abnormal stresses going through, especially that lower neck, then you pay the price down the road. But as they say, you pay with interest, because now there are disc injuries, now there's compressed nerves, now there's a restriction of mobility, muscle spasms, inflammation. And these are the pain syndromes that have allowed in our system pain management departments to grow faster than any other department in healthcare, because we've never addressed the cause of the problem. On the open mouth view, you can see right below the word normal, we have very good alignment and centering of the spine. And that area of the spine is right where the spinal cord goes through those top two segments to bring energy to all levels of the body. When there's an imbalance between the jaw, the occiput, the atlas, and the axis, predictably there's interference in that nervous system that can produce many symptoms, many of which the traditional medical community can say, we don't know the cause of the problem, but we know we can treat the symptoms. And the pharmaceutical industry grows. Whereas if we can address the biomechanical faults, the skeletal system imbalances that house the nervous system, we can begin at the root level to make changes. Now keep in mind, the neck is the 5th floor of a compensating building. All problems originate in the feet, the imbalance in the knees, level or unlevel hips, and the levelness of the low back, and the neck is only the victim that's going to go where it has to go to balance the entire body. So now we look at the low back and we can see that 0.0 millimeters are perfectly level hips. And again, perfect, but not common. What's common is 21.1 millimeters. And this is a young man in 8th grade that's never had an injury. But we know what's coming with those imbalances, because it can be any type of injury. It can be ankle, plantar fasciitis, knee, shin splints, hip, hamstring, any of the injuries, because it's also combined with his activities or her activities and their traumas and their stresses that take place. Here's the side view. The red line is the center of gravity where it should go. And you can see here are 2 examples where that center of gravity is behind where it should be. We know what injuries are predictable in this situation. To the far right, the center of gravity is forward of where it should be. We know what injuries are predictable with this biomechanical fault, and we can begin immediately to make the proactive, corrective care that's needed to mitigate the future injuries of this individual. Now, in this particular case, again, the one on the left is normal. The one on the right, if you look at the lowest vertebrae and look right behind it, you can see that it has slid forward. And that means there's a fracture. This is called a spondylolisthesis, which is very common in middle and high school athletes. Well, a spondylolisthesis is a finding that you need to have experienced doctors, physicians, examiners, when they find it, to know what to do, because it's a wide array of possibilities. And if you're not seasoned and experienced in the care of this, then you probably will make some very bad decisions as to what needs to be done. In many cases, when it first happens and you take that x-ray and you see that bone has moved forward, if you look to the right, you can see the circle around a white patch. And that white patch is in the spine. That's inflammation in the bone. And what that tells us is then that spondylolisthesis just happened, and that now requires a very specific treatment program. However, if that white patch isn't there on MRI, if you were to have an MRI taken because a young man presents with a spondylo and has back pain, if the white patch isn't there, then that means it's an old injury and that athlete is safe to play. But a lot of docs don't know that. They make wrong decisions both ways. They let the athlete go back when it's not time, and they keep the athlete out when it's inappropriate. So you have to understand that condition, and the experience we've had dealing with middle school, high school athletes is what allows us to be able to make all of these decisions correctly. Here you can see the red arrow pointing to a disc injury. It's bulging out and it's extruding, meaning it's also moving downward. So that's a more advanced disc injury. This is a 17-year-old athlete. And again, there are very specific conservative treatments that can be done for this injury. When those conservative treatments don't respond appropriately, that's when either orthopedic care of cortisone injections or surgery may be indicated, but never as a first treatment protocol. The conservative care that we provide and that is available out there should be done prior to any orthopedic involvement. Secondly, if you look at the discs above the injury and you can see the white patches in those discs, that's fluid. That tells us those joints are very well hydrated. And then you see the injured joint, and even the one below it, how dark they are. They call that desiccation or disc dehydration. Disc dehydration means that that joint has not moved properly, and the loading going through that joint has caused it to fixate, which goes back to the imbalance, the feet, the knees, the hips. That's where you're going to start to see it. And that's where chiropractic is invaluable, in that the primary tool we have is joint mobilization. So once we balance the athlete, we mobilize the joints, we keep the hydration in the discs so the discs can function and tolerate a lot more stress. Here we can see that it also shows bone inflammation, which I showed you, the one on the left. The middle, you can see shin splints, and some of that is in the soft tissue, some of that is in the bone. And to the far right, you can see a bone bruise of the knee. So if you hear the word bone bruise, which can only be shown on an MRI, that's typically a 3 to 4 month time frame to heal. So MRI also shows meniscus tears, tendon tears, and ligament tears, but the key is imaging is mandatory for this age group, proactively and preventatively and diagnostically. And you have to have examiners who are very knowledgeable in imaging, and I call imaging the future of sports medicine, because with the proper biomechanical imaging and diagnostic imaging, we can know exactly what the underlying faults are, correct them, what the underlying diagnosis is, correct that, and get this young athlete safely back to where they need to play. So without imaging, you're shooting in the dark and you have no understanding of that young athlete's biomechanical faults that, again, are going to be actuary Alex. There's going to be a dramatically increased cost to their lifetime. So thank you for joining me. Be well. Share this podcast with any families of youth athletes that you know, and I look forward to seeing you next time.